thanks, Anika. It was really interesting actually being part of that last session, because I think when you hear the next 20 minutes or so, I think you might be able to marry some of those technologies up to help you achieve some of the initiatives that have been spoken about today. So we're going to take you on a really high level journey of what we're talking about in terms of automation. It's really difficult to do it in justice in the 15-20 minutes that we've got, but obviously we'll look to do follow-up sessions afterwards. But just to give you an understanding of what we're doing, what's going on across the NHS, but also specifically within Cheshire and Merseyside. So if we can move to the next slide, please, Phil. So you may be thinking, you know, what are we talking about in terms of automation? What are the pressures that we've got at the moment that automation can support us to achieve the outcomes that we're looking to? You'll know from the conversations that you're having daily, the pressures on resources are massive. They're not going to go away. We're not going to get another load of money. What can we do with technology to support that, releasing that time back to the organisation? We know that there's a lot of high-level repetitive processes out there. There's a lot of clinicians doing admin that actually is not utilising their skill set. So much duplication of data. There are a lot of systems across the patch that don't talk to each other. So how do we utilise the technology that we've got available to help us with some of these current issues? Phil, if you could just build the second half of that slide. So this is one of them. This diagram is probably one of the most impactful, I think, in terms of looking at what a human is good at versus what a robot can be good at. We're never going to replace things on the left. A human is always going to have the extra sort of intelligence and subjectivity and intellect really that a robot's got. But actually, there's a lot of the jobs that we're doing out there that have all of the elements on the right hand side that we can actually get a digital worker to do. So again, next slide, please. And if you just build that for me, Phil. Sorry. So what are we talking about here? We're not talking about physical robots. We're talking about software technology that sits in the cloud. It's a scalable pool of digital resources designed to help the team do more. So these digital workers aren't set to a specific process. They can be shared across organisations. They can be shared across different departments to deliver the hours back to the organisation in a safe way. So there's no integration into your systems. They log into a system with a username and password as a human does, and they sit behind the human workforce, churning out the admin processes. They don't make mistakes. They don't take holidays. They don't take breaks. They work 24/7 at a robot speed. So you can imagine, going back to the previous presentation, the referrals that we were talking about, chunking through those 24/7 just to clear a lot of the backlog as well. So next slide, please. So what are the outcomes that we're trying to achieve? So there's qualitative and quantitative outcomes that we're looking at. There's obviously some financial metrics that we measure with the teams that we work on the business case. So we're not here to take away people's jobs, and that's the first thing to say. It's very much how do we reduce the agency spend over time, and we look at natural attrition, we look at the team structures, but ultimately we're looking to be more efficient and effective and drive that quality of data and clinical care. So next slide, please. The good thing is for everyone on the call, this is fairly low risk in terms of it has been done right across the country, right across different organisations and different ICSs. We've got a lot of information that we can share with you and take you on that journey in terms of looking at your processes, looking at what's suitable, analysing your problems, analysing where you've got those big admin processes that we're looking to help you alleviate and release your time back to your staff. So there'll be quite a lot on here that you'll be familiar with. I think we're getting to a point where we're going to struggle to get any more logos on. We've got about 83 NHS customers using automation, and across the ICS, Faye will go into that in a minute, but you've got a lot of organisations embracing this already. So it's about how do we tie that up across the patch and make sure we're streamlining, the way that you guys are working. Next slide, please. And the good thing is as well, we're working across lots of different ICSs. So you've got similar challenges right across the country, looking right across the Cancer Alliance network as well. So we'll be able to introduce you to different workshops. We've got examples of different processes that are already going on out there. Sharon will cover that in a moment. But yeah, the good thing is you're in safe hands in terms of this is tried and tested. We just want to share and be able to collaborate all of that with you. Next one, please. So I'm just going to hand over to Faye now. So she'll give you the Cheshire and Merseyside update of what we've been working on for the last well, it's been 2 years, but obviously been working with Faye for the last 6 months or so, but we've come on quite a journey in the last 6 months. So Faye, I'll just hand over to you.
Thanks, Louise. So the ICS's RPA project started really at the end of last year when the ICS submitted a bid for unified tech funding for digital productivity to support 10 of our trusts to either implement or further develop their automation capabilities using Blue Prism robotic process automation software in order to support recovery, resilience and transformation, better management of patient demands and resource pressures, whilst also delivering short, medium and long-term efficiency savings at local system and regional levels. We actually managed to secure 2.3 million in funding at the start of this year to support those trusts out of available funding of 4 million. So we did really well. And that bid was based around an ICS leveraged pricing structure that was agreed with our partners at E18. And it's been particularly beneficial to us as the second largest ICS in England. Firstly, as it's enabled smaller or more financially challenged ICS members to purchase an RPA platform at a lower cost of entry. And secondly, because thanks to the partnership that E18 have with Royal Free London NHS Foundation Trust, which is an RPA centre of excellence, we've been able to access a catalogue of over 200 automated processes free of charge, which has enabled us to utilise proven pre-built processes, saving us valuable time and money. So in addition to this, our partners at Blue Prism in E18 have also supported us in setting up a number of sessions that we've scheduled in from May to September to really help us to drive collaboration and knowledge sharing, including 10 bi-weekly RPA Steps to Success sessions that are based around the 7 foundations that Blue Prism have identified as being essential to a successful RPA rollout, to help trusts to maximise their investment and make the best use of the extensive resources that are available. And we've also set up monthly themed RPA sessions to enable organisations across Cheshire and Merseyside and different services to get a better understanding of the different areas where automation is being used in health and care settings and of the associated results, to support those organisations and services in thinking about processes that they might want to automate in future. So due to how well the trusts in phase 1 of the project are progressing, we're now exploring the potential for a phase 2, which is really exciting. And we've had interest already from 5 of the remaining 7 trusts in our region who are interested in implementing RPA. And we're exploring a proof of concept pilot for our primary care services that, if proven, will be scaled up across the region. And in addition to that, we're having conversations with our mental health colleagues about how automation can support our improving access to psychological therapies or IAP services. And we're also speaking with you today about the benefits that automation could bring to support our cancer services. So it's a really exciting time, and I can only see the project getting bigger as more processes go live, adding to the benefits that we're already seeing. So with that said, I'm going to hand back over to Louise.
Thanks, Faye. Yeah, Phil, if you could just move on to the next one. I thought we'd just show a really quick, it's only a 2-minute video. It just gives you, it just encompasses that sort of community feel that we've been talking about. And it's less about the technology, it's about this access to lots of different groups of people, lots of processes that have been done before. So if you're okay, Phil, you can play that now. Thank you.
Due to budget cuts, skill shortages and social changes, there are mounting pressures for NHS leaders to adapt to unprecedented challenges. NHS organisations nationwide are deploying Blue Prism Cloud's AI cloud-based digital workforce to automate time-intensive complex tasks, from admissions and GP referrals through to outpatient support and shared back-office functions. These innovative automations help your team spend more vital hours delivering optimal patient care. Secure benefits faster using the NHS Digital Exchange. The NHS Digital Exchange is a central pool of tried and tested automations that allows NHS organisations to share knowledge, deploy and scale a digital workforce fast. Tapping into collective innovation from NHS leaders across the country will drastically reduce the time your team spend on office-based tasks and increase the time spent on improving patient experience. The NHS Digital Exchange allows other NHS organisations across the country to deploy your automations. You will be able to spread the benefits of your ideas beyond your organisation and into the wider NHS. With access to the Digital Exchange, you can log in, download new automations, adapt to your organisation, implement digital workers, and improve your return on investment. One NHS trust has saved more than 10,000 hours of staff time in 1 month alone, whilst other trusts across the country have implemented automations that save hundreds of thousands of pounds per year, prevented more than 1,300 appointments being missed in an 8-week window, and set up new team members at record rates. Through the NHS Digital Exchange, Blue Prism Cloud is proud to foster closer collaboration between healthcare organisations and scale return on investment across the NHS. Join our community of automation pioneers and accelerate the benefits of intelligent automation, delivering more time to care across the NHS.
Brilliant, thank you. So I'm just going to I'm conscious of time, so I'm just going to hand over to Sharon, who's going to give you a little bit more insight in terms of the outpatient transformation and the specific cancer processes that are being rolled out across the country.
Thank you, Louise. So hello, everybody. Just quickly, this slide you can see is a fairly standard elective care pathway. And of course, with cancer, we want to accelerate all of those timelines. There are multiple situations where we can apply automation in this pathway. And examples, as we heard from the risk assessment from Liverpool Head and Neck, would be around the referrals coming in and access to rapid access clinics. So what we have done in the automation journey in other organisations is to support the review of the 2-week rule referral or the suspected cancer referral coming in and uploading into EPR systems in a much more robust and rapid way, facilitating thereby patient access to different clinic types, be that a same-day access clinic or more standard outpatient consultant clinic. We can look to employ RPA in the assessment and the diagnostic tracking pathways. Of course, we know that cancer pathways are very heavily laden with diagnostics in a variety of ways, be that radiology or pathology, and MDT coordinators themselves have to track multiple patients through multiple different systems. And as a result, we can apply RPA to do that very part of that human aspect of the job. And what I mean by that is the robot, the virtual worker can go into the ICE system, the PACS system, whatever diagnostic or pathology related system there is, and create all of that information and put it together in an Excel or other tracking system, thereby freeing up the human time. As we move towards the treatment pathways, we can look to apply automation to help structure things like the radiotherapy or the chemotherapy treatments, because they need to be done at specific time points, but a bit more patient friendly. We can of course use RPA to communicate directly to the patient by sending either text messages or letters to ensure that they have access to systems and services that might reduce their anxiety whilst they're going through their treatment stages. As we look towards the outcoming and the latter stages through to hopefully remission and discharge, again, we can look to apply automation around things like questionnaires to make sure the patients are feeling happier, they're feeling well in themselves from their physical symptoms as well as psychological symptoms. And throughout all of this pathway, of course, with the tighter timescales, we can apply RPA to things like the breach management. So the root cause analysis, why have patients delayed? Why are patients not coming into their treatment in a timely manner? Which again, of course, is quite labour intensive for the MDT coordinator. And we can look to apply automation at a more sophisticated level. So for example, you have patients that are at home, they might have drains in, they might be monitoring different aspects of their symptoms. And using structured data or e-forms, we can get patients to populate that data, and then that data using RPA and automation can be sucked up then into the EPR system. So you've got a record rather than having to have that telephone conversation each time and have a human like a nurse, a CNS, recording that information and then populating it from paper into the EPR system. I am really conscious of time, and so that's a high level whistle stop, but as Louise has said, there's plenty of automations out there around different cancer pathways that we can share with you. I just really wanted to whet your appetite at this moment. Can we move to the next slide, please? So here we've got is a little demo. These are always brilliant to have. This is a 2-week rule referrals going into the Somerset Care database. So Phil, if you could just press play on this one. It actually looks at 2 different patients. One is a breast and the other is an upper GI. So here we can see the virtual worker taking on the format of a human worker, accessing the Somerset Care database. It's uploading referral information directly into it. It's choosing the GP code. Here we go, it's choosing a GP code, populating that. And it's also populating the first appointment date. And then it moves on to the next patient. So we can see how quickly the virtual workers work in comparison to the human workers, which is where obviously we get a lot of efficiency and time saved. And as Louise mentioned before, these work 24/7. So a lot of the processes that we can run are overnight so that we can have reports generated, audit reports, clinical audit, various other systems, processes overnight, meaning that when clinicians come in the morning, there's a wealth of data at their fingertips. So we'll just wait for this to run through. There we go. Again, another kind of a task that is quite mundane for our human workforce to do. So we can see, as I say, the speed at which these virtual workers work is absolutely incredible. We've done work at a previous trust where we've scanned 36,000 letters overnight to pull out key terms. So that's other applications that we can use it for. Okay, we can move on to the next slide, please, Phil. Lovely. So what makes a good process? Automation is perfect for, as we can see, rules-based approaches. We need to ensure that we've got defined parameters for these robots. They're not humans. They don't have the intelligence that we need to apply to some situations, and particularly within clinical services, but they are perfect at what we call if this, then that processes. So defined parameters, and if there is an exception that falls outside of that, then that's reported back for human intervention. Thinking about the inputs, so multiple data inputs are perfect for virtual workforce interventions. We can think about the structured data. So as I've already mentioned, the multiple systems, where that's coming from, and what the outputs are going to be. That makes perfect sense to use a virtual workforce. And then the volume. So if you've got systems and processes in place that require human effort at multiple volumes. So for example, going back to the referrals, we're getting hundreds of referrals in a day. It's often mundane just putting that information into the Infoflex or Somerset or into the EPR system. So actually that lends itself really nicely. It's very structured, it's very rules-based, it's very systemized approach to automation. And the last one is applications, because what we want is stable applications for these virtual workers. We don't want an application where there's going to be multiple upgrades and multiple changes, because as we see from the very first one, it needs to be rules-based. If there is software changes in sort of pilot software, it will often cause an exception, what we call a business exception. So that's a high level of what makes a good process. If we move to the next slide, we can talk about our engagement model. Lovely, thank you. So as E18, we can see here, we've already mentioned that we work very closely with Blue Prism. We work with another company called Advance. They provide virtual smart cards. So when we're looking at patient level data, we have a physical smart card, but we use virtual smart cards for our robot workers. And we work with two Centre of Excellences, the Royal Free that Faye has mentioned, but also Alderhay. So what we do is we have structured stakeholder engagement. We run workshops, as Faye's mentioned, across Cheshire and Merseyside. We've run multiple workshops already, and we've got a programme in place at trust level as well as ICS level. We help organisations, be it at PCN or trust level, to review the processes to make sure that they are, as we say, high volume, good automation candidates that are going to get maximum return on the investment made. We offer workshops, skilled expertise. We draw upon other organisations, other NHS trusts that have implemented it, particularly obviously as we're talking around cancer, we'd be looking to other cancer trusts to share best practice. We do multiple deep dives, so as I've mentioned, the workshops, but exploring with the metrics and other software partners that might sit outside of automation that we can bring in to support a truly transformed journey. We handhold through the technical setup. I've mentioned the virtual smart cards already, but we can support with information governance or regulating authorities on the virtual smart cards, right through to the platform setup, and right through then to getting your first developed process implemented and in situ. And then we go through all of the working with you for your pipeline and your strategic roadmap, because it might be as a team that you decide, as an organisation, that you want to have your in-house developers that can work very closely with the Blue Prism software and then create bespoke processes internally. That is my whistle-stop tour, and I shall just say move to the next slide, please, and close there. Thank you.